Hi everyone, welcome to Self-Balance Live. I'm Szenan-Balance from Self-Balance, the acupuncturist. Right. Today's topic, we're going to talk about what is the best treatment for recurrent urinary tract infection. So, what is the best treatment for chronic recurrent urinary tract infections? Right. This is the last topic of UTI, the chronic UTI, which means a patient who suffered from UTI not long ago, and then the UTI keep coming back, recurrent one. It keep happening. So we're gonna talk about how to get rid of it. What is the best treatment for it? Okay. Again, the best treatment for this is not just rely on one method. It's a combination solutions. It is a combination solution for this. Right? Now, before I really start to talk about it, I have to go to my my Facebook, my page, and to share is a watch party. Now, can you please, hi Veronica, see you, thank you. Can you please give me a thumbs up and a love and say hi to me if you're on Facebook, Instagram, or YouTube. Then the next thing I want you to do for me is please tag your friend who suffer from UTI, especially chronic UTI, and I'm going to give some advice to you guys and how can you get rid of it. Right? Then share this live video, please, as a watch party on your Facebook. Thank you. The next thing I'm going to do is going to go to my personal Instagram and put a live video as well. So I'm going to try to reach as many people as I can and to help more and more people to get this, to share this knowledge to everyone. Now, if you're an acupuncturist, I'm going to share with you some acupuncture points, strategies later on. I'm going to write down the points I've got on my computer. Because you know, I study Chinese medicine Chinese and acupuncture in Chinese, and so I know all the point name in Chinese, but not in English. I'll try my best. I figured out all the points already, and I'll write it down to show you guys. Coming to this, going to do this. Okay. Here you go. Right. So what's our topic? The best treatment for chronic UTI. Now, as you probably know, what we're talking about UTI, we've been talking about UTI the whole time, right? So most UTIs go away after treatment. We mean that the acute one, most of them go away after treatment. No matter what treatment you get. Why is that? Because you still have your strong immune system. Once you go away, your immune system recover and then stay the way as healthy as you can, then you won't get UTI, or the UTI won't happen until another year. But the topic we're going to talk to today is chronic UTIs. Chronic UTI either don't go away after treatment or keep coming back, recurring. The recurrent UTIs are common in women, very common in women. I've seen UTI in women recurrent. I've seen that. But I haven't seen the recurrent one in men yet. No cases in my clinic at the moment. But I've seen recurrent one with women. No cases in my main in my clinic. It doesn't mean there is no case, right? It just means that with those I haven't met any of them. They probably have it. They went to a hospital, went to a GP, not coming to me, right? So which means I'm not getting this message out as much as I can and as regular as I can, and no one know about me yet, right? So many cases of recurrent UTIs are from reinfection with the same type of bacteria. So how do you know that? We discussed this really. This is because they do the urine culture. The urine culture could tell what sort of bacterial infect causing the UTI. So, however, okay, some recurrent cases don't necessarily involve with the same type of bacteria. And how do you know that? Yes, urine culture again. But I have to tell you, the cases that I have met in my clinic, they give up to do the urine culture. They don't normally use it. They don't normally do that. You don't have the time and you get sick of it, because what is the point to keep doing urine culture? Because there is nothing you can do about it. For a Western doctor, for your GP, medical doctor, they keep giving you antibiotics because this is the only way they can help you. And that is you find it is useless, right? Because it doesn't matter what type of bacteria that you got, you can't get rid of it, and that's the reality. So when you can't get rid of the bacteria, so what is the point to keep doing and figure it out what sort of bacteria is it? So here come the Chinese medicines. Why is that? So this concept is very important. If you are an acupuncturist, Chinese medicine doctor, and you don't have this idea, this concept, and you keep trying to fight with the bacteria, you have the wrong idea. Now, if you're a patient and you're watching this live video, and this idea is important too, I know you're miserable because no one can help you. Those other modalities that you've been helping, you've been receiving, and it hasn't been working for you. Yes, it get rid of it, but it keep coming back, or it didn't help you at all. Now, why is that? Because in the Western medicine, they keep looking for what type of bacteria. Even though they confirm that the bacteria is there, and they know what type of bacteria, and they give you antibiotics. Antibiotics supposed to be work, but it didn't. You keep getting the symptoms. And some of my patients, they get what? They went for urine culture. They get and the result came back and said, well, there is no infection. But what happened? They get the symptoms. They get UTI symptoms. They get burning sensation. They get low abdominal pain. When they go to the toilet, they get burning sensation. They feel difficult to pass the urine, difficult to empty the urine. All the symptoms are exactly UTI symptoms. But there is no bacteria. What do? Two options for GP. They say, oh, sorry, we can't help you because there is no bacterial. And one other GP idea is, well, let's just take some antibiotic to see whether it works or not. You see? So in Western doctor, you run out of solutions. You run out of solution because the concept of you is you have to find out the bacteria. Then when your antibiotic doesn't work, you run out of solution. What about Chinese medicine? What about acupuncture? Now, this is different. We have the concept of when there is bacteria, virus, any kind of we call evil things, 邪气 in Chinese medicine, we pass it out. We don't try to fight with it. Okay, this is the first concept you need to know. Therefore, when it comes to acupuncture and Chinese medicines, we give you the herbs or we stimulate the point to help you pass more urine. So you drink a lot of water, you pass urine. We pass it out. Doesn't matter whether it's a virus or what type, any kind of type of bacteria, you just pass it out of your body. That's it. Simple, right? So when you have this concept, when we have this concept, we are no longer fighting with the bacteria. We no longer need to understand what type of bacteria is that. We just pass it all out. That's it. Okay. Second idea that I give you is in Chinese medicine, we call if the great energy, which is your immune system, is there. Doesn't matter what type of bacteria. We don't care about what type of bacteria. When there's bacteria or virus in your body, your own immune system is strong enough to fight with it. Then your own immune system will fight and you will gain your health back. Does it make sense? Which means we no longer need to know again what sort of bacteria or virus they are. We just boost up your immune system. So through boost up your immune system, building up your immune system, once your immune system's up, you can fight with the bacteria. And that is the best solutions and best idea. So two ideas in Chinese medicine and acupuncture. And how could we achieve those two ideas? It's perfect. That is a perfect idea. I don't know whether you have noticed it or not. This is Chinese medicine. This is acupuncture idea. And once we have the idea, like the theory, then we, according to the idea and the theory, this is our goal. Then we create the treatment plan. Right. The treatment is balance the organs. So for most of the low immune system, you get very tired. People get, when they run tired, they feel tired, low energy, and they start to get an infection. Common. When I meet my patient, those recurrent, most of them have the same common complaint. I have low energy. I get fatigued. I feel tired all the time. This is that kind of patient. They feel good sometimes, but whenever they get tired, they get recurrent UTIs. Right? That is the system strategy that I'm going to show you. I have to go to my computer. Okay. We use medical aid or medical aid plus one. All right. Let me put it down. So doctor, you might want to get a pain if you are acupuncturist. I'm going to teach you what medical aid +1 point. We call Dr. Tan medical aid points, right? And draw a man, a woman. Okay, unhappy because suffer from UTI. On the right side, all right, on the right side, we do PC6, pericardium 6, and lung 7, and as well as heart 5. On the oppositely, which is the left side, spleen 9, liver 8, three point in here, 2 point in here. That's the acupuncture point. All right. Then on the left side, left hand, Sanjiao 5. I'm using a black pen. And large intestine 4. On the right side, stomach 36 and GB 34. You see that? This is medical aid +1. Medical aid +1. So why do we do medical aid +1? Why do we do this strategy? Because we want to get this stomach and spleen function better. When stomach and spleen function better, your lung and large intestine will be better. And with this strategy, it can actually balance all the organs, but it focus on here, more focus in here and here, right? And it can decrease your stress as well. Liver and gallbladder. It actually treat the heart, and actually treat all organs. So entire body from here to here, treat all the organs. When you treat all the organs function better, then you feel you gain more energy, your digestive system's better. When you be able to get more nutrients, and your lung be able to get oxygen into your blood, and it build up your blood system. The blood flows better, circulation better. Then all organs have enough blood supply, and their circulation is better. Then they function better. When you function better, first thing you do is you feel more calm. The second thing you do is you get more energy. Once you get that, which means your immune system's up, it will fight with bacteria. We are not giving you any drugs, any herbs to try to fight with the bacteria. We are trying to boost up your immune system. Okay, what else can you do to boost up your immune system? Diet. Plant-based diet is the best for boosting up your immune system. Right. We're talking, I mentioned it again and again because when it comes to meat, if you eat a lot of meat, right, it's very difficult to digest. If you eat plant-based, much easier to digest. When things easier to digest, you don't have to use so much energy to digest the food, to absorb the food, because you're so tired. You haven't got enough energy, and your stomach and spleen is weak. You can't digest those food that is difficult for you to digest, which is meat. any animal protein. Animal protein is very difficult to digest, very, very difficult to digest, and cut down your meal. So if you eat a big meal every meal, cut it into half. Cut it into half first, and eat less. Because if you feel after eating you get sleepy or bloating, one of the main reasons is you are eating too much. How many times can one treat a patient in a week? 3 times. For this recurrent one, I normally started with 2 or 3 times, depending how serious is the problem. Okay, so if they have symptoms, 2 to 3 times. When the symptoms gone, in the first month, I normally do 2 acupuncture in the first month. Then when the patients get better after the first month, and they cut it down to 1 treatment weekly for another month, and I get a re-examination. When the patients get better, cut it down even further, 1 acupuncture every 2 weeks, and cut it down even further, 1 acupuncture every 3 weeks, 1 acupuncture every 4 weeks. And maintaining there 1 acupuncture every 4 weeks. If everything's fine, just 1 acupuncture every 4 weeks for about 6 months or up to 12 months. Why do you do this? Because you want to keep stimulant point for the patient's organs function maintaining there. So go for about a year treatment or 2-year treatment, then you may be able to get rid of the chronic UTI. That's a treatment plan. I'm not saying that it's gonna get overnight treatment in just 1 or 2 times, 1 or 2 weeks, or even 1 or 2 months, you're gonna fix chronic UTI. It's not that simple. It's not that simple. All right. You don't rely on just acupuncture. Keep in mind there. All right. Now, if you're watching this video on our Facebook page or a YouTube page, you're living in Hamilton, Auckland, or Cambridge, then you need a solution. You need to see whether you run out of solution. Call us 078467956. We're happy to help you. We're happy to help you. Come in for initial examination. It only costs you $40. It's very cheap. It normally costs $120 for initial examination. For a full hour, you have to fill in the form and come in, and we're going to go through the form and figure out which organs are out of balance. Therefore, we'll create a plan and let you know how long it's going to take for you, how much it's going to cost you, what treatment solution involved with the treatment. This is what we do in our clinic. So call us on 078467956. Thank you. Now you know. If you're an acupuncturist, this strategy is very, very useful for you. Right. And what do you get patients to do at home? Those 3 points, we mentioned it in the past. This one, massage this one, massage pericardium 6 and stomach 36. Liver 4, pericardium 6, stomach 36 can also balance all the organs. So this is patient, something that you can do acupressure point at home and practice breathing to decrease your stress, and as well as 2 legs exercise. This is a home program that we create in our clinic, provide to all patients. Every patient should do this. We suggest every patient to do this for the rest of your life. Now, I always tell my patients, you see, if you have high blood pressure, high blood sugar, and heart disease, and your GP, your medical doctor will suggest you take this drug for the rest of your life. What do we do as acupuncturists? We create a home program which is acupressure point that could balance all the organs for you, and we teach you how to breathe properly, how to do breathing exercise and 2 legs exercise every day for your rest of your life. I do it every day, and I want you to do it every day because I want you to be healthy. Right. Stay awesome. This is the best treatment options that I think is the best for chronic UTIs. Stay awesome. I'll see you tomorrow. Tomorrow we're gonna start a new topic. Stay awesome. Bye bye.